Hi, Doc Corkins again here. I want to talk about another injury that occurs during whiplash. This injury occurs in the lower part of the neck, mainly from C2 down to C7. I have here the big bones model of the neck. Up here is the head, here is the bones in the neck, and of course the body would be down here. And if you could zoom in on that, you'll see on the big bones I've taken and I put tape in such a way that colored tape that represents the various ligaments that hold all the bones in the neck together. These ligaments are important and they get damaged in a whiplash type of injury. This first blue tape shown here in this model represents the anterior, which is of course the front of the body, anterior longitudinal ligament. Stands to reason, it's a long ligament and it courses from the top of the neck to the bottom of the neck, and the purpose of that ligament is to keep the vertebrae from sliding forward. It's kind of like spandex or duct tape. You got all these loose bones in there, but you need some supporting material to keep them aligned. So when this particular ligament gets damaged, it allows the top vertebrae to slide backwards on the one below. So in this particular model, here's C1, C2, C3, C4, got that wrong here, 2, 3, 4, 5. Okay, here at 4, 5, if you look at the side here, if this at this alignment, if the top one falls back, we call that a retrolisthesis. Listhesis simply means bone out of place, and that top bone is out of place with respect to the bottom bone. It is slid back, and because it's moved backward, we give it the designation of a retrolisthesis. Now, I'm going to show you some x-rays that show that when you move into flexion and extension, if there's damage there, you will see abnormal movement and you will see a retrolisthesis.
In this patient, you'll see a retrolisthesis at C3, C4. As she flexes forward in the motion x-ray, there's complete alignment of 3-4 as she flexes down, but as she goes and looks up, there is a movement of 3 millimeters of 3-4. Here again, I'm going to let the patient flex forward and show you that the alignment is perfectly straight. But then as she comes back into extension, again, there is a slippage of 3-4. And just let your eye float at level 3 or 4 and you can see that vertebrae moving back and forth. On this patient, there is 2 retrolisthesis at 3-4 and 4-5, and the movement is 3 millimeters at one level and 2.2 millimeters at 4-5. So this 2 retrolisthesis, notice as she goes into extension that they completely line up, but as she looks up, then you'll see one slide back on the other. These patients have a tendency to have severe headaches, neck pain and spasms, and they don't like to look up. They lose their extension ability, and this is the beginning of the degenerative disease process. So if you've been involved in an accident, get yourself checked out by calling the Advanced Spine Center at 561-433-4184.